Finally, Dr. Mahadevan, after all the terrible loss of life, the economic losses and frustration due to isolation, uncertainty, do we have hope?
I can truly understand your question. There have been times where we've questioned whether there is hope or not. And the last 2 years have been a long and painful journey for many of us. Almost all of us know someone who's lost their life to COVID. And for healthcare professionals around the world, it's been physically and emotionally exhausting. But there is reason for hope, and we're already seeing signs of it. The COVID vaccines are working across the world. In areas with high vaccination rates, like where I live in the San Francisco Bay Area, the number of COVID cases has fallen dramatically. There are fewer people getting admitted to the hospital and much, much fewer deaths. Life is slowly but surely returning to normal. In fact, there have been days where we haven't had a single positive case in our emergency department. And despite the development of these COVID variants around the world, we're finding that the immunity from the COVID vaccines has been effective thus far against these new strains. And while it's conceivable that we may need a booster vaccine in the future, presently the vaccines have dramatically reduced the chance of dying from COVID to just 1 in a million. So please get vaccinated. Please sign up to be vaccinated. Please encourage your friends, family, and colleagues to get vaccinated. Vaccination is the only way to end the pandemic. And just as a matter of reference, before I got vaccinated in December of 2020, in spite of spending a lot of time in enclosed rooms with very sick patients with COVID, breathing out the virus into that enclosed room, I was able to protect myself by wearing a mask, by using gloves and gowns, and by adhering to strict hand hygiene. And fortunately, I did not get COVID in spite of my high-risk profession and these routine and regular exposures. So please remember these important principles to keep yourself and your family safe and healthy. Number one, you can't tell whether someone is infected with COVID by their appearance alone. Number two, COVID spreads through the air when we talk, when we laugh, when we sing. And finally, number three, good hand hygiene can also prevent the spread of COVID. Thank you so much for having me.
Thank you so much for your time and guidance, Dr. Mahadev. I do believe this information will help endorse some safe behaviors. And my best takeaway is there is hope.